Welcome to Health Forward, the podcast that brings you cutting-edge medical research and health insights that could transform your life. I'm your host, and today we're diving deep into a topic that affects millions, but remains surprisingly misunderstood: the human papillomavirus, or HPV, and its connection to preventable cancers. If you've ever wondered about vaccine safety, cancer prevention, or why certain regions of America are facing higher cancer rates, this episode is specifically designed for you. We're going to unpack groundbreaking research from the Medical University of South Carolina that reveals shocking gaps in public health awareness, gaps that could be costing lives. Before we begin, I want to extend a warm invitation to our new listeners joining us from across the United States, Europe, and around the world. Whether you're a healthcare professional, a concerned parent, or simply someone who values evidence-based health information, you're exactly where you need to be. Today's discussion could very well save your life or the life of someone you love. The startling reality: America's HPV knowledge gap. Let's start with a number that should make every American pause: 34%. That's the percentage of Americans who don't even know that HPV exists, according to revolutionary new research published in JAMA Oncology. Think about that for a moment. We're talking about 1/3 of the entire American population being completely unaware of a virus that causes 40,000 cancers annually in the United States alone. But here's where it gets even more concerning. Among those who do know about HPV, 71% don't realize it can cause oral cancer, and shockingly, 28% don't even know it causes cervical cancer, the very cancer it's most famous for causing. Dr. Eshvita Garg, the lead researcher from the Medical University of South Carolina, describes this as a public health crisis hiding in plain sight. Some of these states have the lowest HPV vaccine coverage in the nation, which could be a reason why we are observing these differences, she explained in her groundbreaking study. This isn't just about statistics. This is about cancer prevention, vaccine efficacy, and health education that could literally save millions of lives. Understanding HPV, the most common STI you've never heard of. Human papillomavirus isn't just one virus. It's a family of over 200 different types that spread through skin-to-skin contact, including sexual contact. This makes HPV the most common sexually transmitted infection worldwide. Yet most people couldn't tell you the first thing about it. Here's what makes HPV particularly insidious. Some types are relatively harmless, causing only warts, while high-risk HPV types can linger in your body for years, silently causing cellular changes that lead to cancer. We're not talking about rare cancers here. We're talking about cervical cancer, oral cancer, penile cancer, vaginal cancer, and vulvar cancer. The research reveals something particularly striking about gender differences in cancer risk. While most people associate HPV with women's health, HPV-related oral cancer is actually more common in men than women. This finding highlights a critical gap in public understanding and explains why male HPV vaccination rates remain concerningly low. What's truly remarkable is that all of this is now almost entirely preventable through vaccination. The current HPV vaccines can prevent up to 9 different high-risk types of HPV, yet vaccination rates remain stubbornly low across much of America. The geographic divide, regional disparities in health awareness. The research uncovered a troubling pattern when examining HPV awareness by state. 7 states showed particularly high levels of ignorance about both HPV and the HPV vaccine. Over 40% of residents in these areas were completely unaware of either. The states with the lowest awareness include Kansas, Nebraska, Illinois in the Midwest, and Mississippi, Arkansas, Alabama in the South. This isn't coincidence. These same states have some of the lowest HPV vaccination rates in the country. Dr. Garg's team discovered that approximately 62% of all HPV-related cancers occur in the southern and midwestern United States. This creates a devastating cycle. Low awareness leads to low vaccination rates, which leads to higher cancer rates, which could be prevented with better health education and vaccine access. This geographic disparity raises important questions about healthcare equity, public health infrastructure, and how medical misinformation spreads differently across regions. It also highlights the critical need for targeted cancer awareness campaigns in these underserved areas. The science of prevention, how HPV vaccines save lives. Let's talk about one of modern medicine's greatest success stories, HPV vaccine effectiveness. Countries that have implemented comprehensive HPV vaccination programs are literally beginning to eliminate cervical cancer. Australia, for example, is on track to become the first country to completely eliminate cervical cancer as a public health problem. The vaccine safety profile is exceptional. Decades of research involving millions of doses have consistently demonstrated that HPV vaccines are both safe and highly effective. The current vaccines protect against the HPV types responsible for approximately 90% of cervical cancers and 95% of anal cancers. Here's what many people don't realize. The HPV vaccine is most effective when given before exposure to the virus, which is why adolescent vaccination is recommended. The CDC recommends HPV vaccination for all children ages 11-12, with catch-up vaccination available through age 26. Despite this remarkable preventative medicine success story, American vaccination rates remain disappointingly low. Only about 57% of American teenagers received the HPV vaccine as recommended in 2023, well below the 80% target goal that health officials hope to reach by 2030. Breaking down barriers, addressing vaccine hesitancy and misinformation. One of the most significant challenges in HPV cancer prevention is addressing vaccine misinformation. The research indicates that misinformation campaigns have been particularly effective at spreading fear about HPV vaccine safety, despite overwhelming scientific evidence supporting both safety and efficacy. Unfortunately, this misinformation has reached the highest levels of government. The current health secretary has made numerous false claims about HPV vaccines, calling them dangerous, despite extensive clinical research proving otherwise. This type of medical misinformation from authority figures can have devastating public health consequences. Healthcare providers play a crucial role in combating misinformation through patient education and evidence-based recommendations. Studies show that strong provider recommendations are one of the most effective ways to increase vaccination acceptance. The key to overcoming vaccine hesitancy lies in health communication that acknowledges concerns while providing accurate, science-based information. This includes discussing vaccine side effects honestly, the most common being temporary soreness at the injection site, while emphasizing the dramatic cancer prevention benefits. The male factor, understanding HPV's impact across genders. One of the most significant findings in the research concerns the gender gap in HPV awareness. While most people associate HPV with women's health and cervical cancer screening, the reality is that men face substantial risks as well. HPV-related oral cancer rates have been increasing dramatically, particularly among men. This includes cancers of the throat, tongue, and tonsils. Many of these cancers are now more common than cervical cancer in some demographics. Yet male HPV vaccination rates remain significantly lower than female rates. This disparity stems from several factors: limited men's health education about HPV, misconceptions about who needs the vaccine, and inadequate healthcare provider recommendations for male patients. The research emphasizes that HPV prevention must be viewed as a universal health issue, not just a women's health issue. The cancer prevention benefits for men are substantial. HPV vaccination in males not only protects them from penile cancer and oral cancer, but also contributes to herd immunity, protecting their current and future partners. Global success stories, learning from international HPV vaccination programs. While the United States lags behind in HPV vaccination coverage, several countries have demonstrated what's possible with comprehensive public health initiatives. These international success stories provide roadmaps for improving American health outcomes. Australia's HPV vaccination program began in 2007 and achieved over 80% coverage rates through school-based vaccination programs. The results have been remarkable. Dramatic reductions in genital warts, cervical precancers, and HPV infections across all age groups. Rwanda achieved over 90% HPV vaccination coverage through innovative community-based approaches, proving that even resource-limited settings can achieve extraordinary vaccine coverage with proper planning and community engagement. Scotland has seen such dramatic reductions in cervical cancer rates that researchers predict virtual elimination of the disease in women born after 1988. These international health success stories demonstrate that HPV cancer elimination is not just possible, it's already happening. The common elements of successful programs include strong government health policy, comprehensive school health programs, effective community outreach, and consistent healthcare provider training and support. Looking forward, innovation and future strategies. The future of HPV prevention lies in multifaceted approaches that address the various barriers to vaccination. Dr. Garg's team at the Medical University of South Carolina exemplifies this comprehensive approach through initiatives like the HPV Vaccination Van, which brings vaccine access directly to underserved communities. Digital health strategies are showing promise in reaching younger demographics through social media campaigns and interactive educational platforms. Telehealth consultations are expanding access to preventative care discussions, particularly in rural areas with limited healthcare infrastructure. Artificial intelligence and machine learning are being deployed to identify at-risk populations and personalize health education messages. These medical technology advances could dramatically improve the effectiveness of public health campaigns. Research into next-generation vaccines continues, with scientists working on formulations that could provide even broader protection against additional cancer-causing HPV types. Therapeutic vaccines that could treat existing infections are also in development. Policy innovations at state and local levels, including school vaccination requirements and insurance coverage improvements, are showing measurable impacts on vaccination rates and subsequent cancer incidents. Taking action, practical steps for individuals and communities. Knowledge without action remains powerless. Here's how listeners can translate today's information into meaningful cancer prevention steps. For parents, schedule conversations with your children's healthcare providers about HPV vaccination. Don't wait for providers to bring it up. Be proactive advocates for your children's long-term health. The vaccine schedule is most effective when started at ages 11 to 12, but catch-up vaccination is available through age 26. For adults, if you're under 27 and haven't been vaccinated, discuss HPV vaccination with your provider. Even if you've been sexually active, vaccination can still provide protection against HPV types you haven't encountered. For healthcare providers, strengthen your patient education approaches. The research shows that strong provider recommendations are among the most effective interventions for increasing vaccination acceptance. For community leaders, advocate for evidence-based health education in schools and community organizations. Support public health funding for vaccination programs and health literacy initiatives. For everyone, combat medical misinformation by sharing evidence-based health information from reputable sources. Your social media posts and conversations can literally save lives by increasing health awareness. As we wrap up today's deep dive into HPV cancer prevention, let's return to those startling statistics we opened with. 40,000 Americans develop HPV-related cancers every year, cancers that are now almost entirely preventable through vaccination. The research from Dr. Garg's team at the Medical University of South Carolina has illuminated a path forward. We know where the knowledge gaps exist, we understand the geographic disparities, and we have proven interventions that work. What we need now is collective action. The success stories from countries like Australia, Rwanda, and Scotland prove that HPV cancer elimination isn't just a distant dream, it's an achievable public health goal. But it requires all of us to be part of the solution. Whether you're a parent researching vaccine safety, a healthcare provider counseling patients, or simply someone who believes in evidence-based medicine, you have a role to play in this cancer prevention mission. Thank you for joining us on this crucial health journey today. Your time and attention matter, and I genuinely hope this information empowers you to make informed decisions about your health and the health of those you care about. Before you go, I have 3 important requests. First, if this episode provided valuable insights, please subscribe to our channel and hit that notification bell. Your subscription helps us reach more people with life-saving health information. Second, share this episode with your friends, family, and social networks. HPV awareness saves lives, and you could be the person who shares information that prevents someone's cancer diagnosis. Third, leave us a positive comment below, sharing your thoughts or questions about today's topic. Your engagement helps YouTube's algorithm share this content with people who need it most, and your questions help shape our future episodes. Important medical disclaimer. While we strive to provide accurate, evidence-based health information, the content of this podcast does not replace professional medical advice, diagnosis, or treatment. Always consult with qualified healthcare professionals regarding your specific health concerns and before making any medical decisions, including vaccination choices. Until next time, stay informed, stay healthy, and remember, the best medicine is often prevention.